wanted to do a super quick, like this will be quick because I have a meeting. Here's my model of your uterus. This one happens to have an IUD in it, a cervix, a vagina. The opening of the cervix is right here. This is not exactly to scale because the cervix itself wouldn't typically be that big, but this is a quick lesson on what happens when you go to the doctor. She will put the speculum into the vagina. We don't have a vulva on this picture, but the vulva would be on the outside. The speculum would go in. This is a speculum. A speculum is not a clamp. No one's going like that. They're opening it. So it's gonna go into the vagina, gently open, so that the doctor can see the cervix. That little hole we call the os, which means mouth, which means opening in Latin. So the cervical os. And if you're having a Pap smear test, you're gonna have a quick little swab of that part of the cervix, the opening. But every time a speculum goes into your vagina, it's not a Pap smear. So I say that because we often hear patients say, oh, I was in the ER, they did a Pap smear. If you went to the ER and they put a speculum in, and you probably went because you were either bleeding heavily or you were having pain with discharge, they're not doing a Pap smear. Your Pap smear is the screening test for cervical cancer. It is nothing but that. So it's not meant to be the test that in the emergency room they're going to do to look for infections, like if you had gonorrhea, chlamydia, yeast, bacterial vaginosis. It is not a test they're going to do in the setting of acute bleeding. They might do an ultrasound. They might do the speculum to look to see if you had anything on your cervix causing bleeding, like a polyp or a growth, but they will not be doing a Pap smear. So again, this is the model of your uterus. We need to get to know this better. There are a lot of things about our body and our health as humans who have uteruses and ovaries and vaginas and vulvas and tubes and sometimes breasts that we just don't know. So we need to learn more, okay? Speculum, not a clamp. Uterus, vagina, cervix. The outside would be the vulva, okay? Let's start to really learn it. It'll be so much better.